अपने आसपास में हम देखते हैं कोई भी सिम्टम आ रहा है, उसको चेस्ट पेन लग रहा है या कुछ अनयूजुअल चीज हो रही है, तो उसमें व्हाट फर्स्ट थिंग दे शुड डू और व्हाट वी शुड डू?
अगर हमारे आसपास किसी को ऐसे सडन चेस्ट पेन फील होता है, लाइक वी हैव डिस्कस्ड द पॉइंटर्स व्हिच पॉइंट टुवर्ड्स अ कार्डिक नेचर ऑफ चेस्ट पेन. If you feel it's that sort of a chest pain, the first thing that you do is you ask for help immediately. Call the emergency services and try to move to the hospital. By the time the professional help arrives, in the meanwhile, you can make the person as calm as possible. If the person becomes more anxious, the complications of heart attack will go on increasing. So you have to make sure the person sits or lies down, is not walking or standing. Make the person calm and relaxed. If you have Disprin at home, make sure that you give 300 milligrams of Disprin to the person, because Disprin, what it does is it's a blood thinner. It will reduce the formation of clot inside the arteries, and even if some clots have already formed, it may slightly melt them away, so the patient may have some relief in the chest pain. Thirdly, if the patient becomes unconscious, then you have no other option but to start CPR. The basics of CPR everybody should know. First of all, you assess whether the person is able to breathe or not. If the person is not able to breathe, you start chest compressions. So chest compressions, you put your one hand in the middle of the chest between the two nipples, and you put the other hand on top of the first hand, interlock both the fingers, and you begin chest compressions at the rate of around 100 to 120 compressions per minute. So that's a bit fast. And make sure that every time you compress the chest, it's at least 5 centimeters deep into the chest, and make sure that the chest rises back fully before you do the next compression. Until the patient starts breathing again, or until the professional help arrives, this is what you need to do for that patient.
So my takeaway from this is that first, do not try to deal it yourself. In a sense
Exactly.
that,
You first thing you do is you ask for professional
yeah,
help.
you call ambulance,
Yes.
right? Either you
Yes.
rush to a hospital nearby
Yes. Yes.
or you call ambulance,
Correct.
जो आपको आके असेस करे, हेल्प करे, क्योंकि
Correct.
दोस मोमेंट्स आर वेरी प्रेशियस.
Correct.
वो 5-7 मिनट, 10 मिनट, 15 मिनट बहुत वाइटल हो सकते हैं आपका.
Correct.
उस समय पे अगर आपने टाइमली इफ यू रीच टू द फैसिलिटी,
Right.
देन डॉक्टर्स आर एबल टू.
In cases of heart attack, there's a common saying which says time is muscle. So as early as you reach the hospital, as many heart muscles you can save. If you reach late, the more heart muscles are going to be damaged forever.
and they're not going to get revived.
They're not going to get revived if you become too late. So
Got it.
that's why people who live with heart failure, so they have one episode of heart attack, the pumping of their heart, or what we call as ejection fraction, reduces, and then they have to live permanently with that reduced ejection fraction, just because they could not reach the hospital at an early stage. If they reached hospital within, say, first 1 to 2 hours, the heart can become completely normal later on.
जो इनिशियल टाइम है, फटाफट से आपको हॉस्पिटल पहुंचना, दैट इज द मोस्ट
Correct,
इंपॉर्टेंट
correct.
थिंग.
And there are common myths in the society कि अदरक खिला दो, ये कर लो, वो कर लो. These things do not help. Only thing which you can do at your level is you can give 1 tablet of Disprin. I would request everyone to keep Disprin tablets at home. Even if it's not available, you can just walk into the nearby pharmacy. Disprin is available over the counter. You can just purchase 1 tablet of 300 milligrams of Disprin and give it to the patient.
सर, सॉर्बिट्रेट हम सुनते हैं आमतौर से कि भी
Correct.
अगर किसी को हार्ट अटैक जैसा एपिसोड हो रहा है तो उसको
Correct.
सॉर्बिट्रेट दे दो.
Correct. So sorbitrate is not recommended for heart attacks. Number one. So this is a big myth which I must clear right now.
So aspirin should be used.
Aspirin or Disprin, both are the same things, that should be
Yeah.
used.
Okay, नॉर्मल से जो डिस्प्रिन की
Normally
गोली.
we recommend Disprin and not aspirin. Comes in various names. It comes as Ecosprin, aspirin, Disprin. Disprin is the chewable form.
Yeah.
So you can just put it in the mouth, it just melts and it goes into your blood circulation really fast. While if you take the normal aspirin or Ecosprin tablets, they'll have to go inside your stomach, get absorbed in the blood, so it will take a lot of time. So that's why Disprin is the one which is advisable to take.
सर, नॉर्मल जो एक टैबलेट डिस्प्रिन का होता है, दैट इज वन इज इनफ और वी नीड टू टेक?
No, 1 tablet is enough. 1 tablet of Disprin comes in the form of 325 milligrams.
Okay.
That is what is recommended. Just 1 tablet, do not take more than that.
Without
Because it's
water.
a blood thinner. It's a blood thinner. If you take more, it can lead to bleeding also. So take only 1 tablet, and you can put it in water also, or you can just put it below your tongue also. It will get absorbed. Both the ways are doable.